Francois, good evening. Thank you so much for your time. It's a grim milestone, isn't it? I mean, 1 million people killed by COVID-19 so far globally. I mean, we understood the impact that COVID-19 would have, but still, 1 million is a terrible number.
It's a terrible number. It might be the biggest killer in the world, the single biggest cause of death this year. And certainly in South Africa, there's still projections that it'll be our #1 killer for 2020. So yes, it's a grim milestone. I think there are a lot of people who've said, oh, this is just flu. This is not just flu. This thing has killed a huge number of people.
What do we need to be reflecting on as we look at this milestone? What lessons have we taken? And do we need to take some lessons from the last 9 months or so, and what are those?
So I think certainly South Africa needs to think very hard about pitting one disease against the other, because it's almost shut down its entire healthcare system, on the basis that we wanted to protect COVID lives. So many people here are going to die of TB, of HIV, of vaccine-preventable diseases. We need to do both. We need to protect people from COVID, but you also need to keep the wheels turning in the rest of the healthcare system. And unfortunately, we did not get that balance right. I think the things we have learned are good is how to treat COVID patients. We've seen the death rates across the world, and including in South Africa, as the doctors gain experience quite quickly, patients are doing better and better once they get sick. So that has been a good news story. There's a whole lot of very promising drugs, and as you people well know, there's dozens of vaccines in the mix, all of which hopefully will make sure that subsequent waves are not so terrible.
A lot of things have changed, Francois. The virus has revealed quite a lot, the inefficiencies in our healthcare system, whether you talk the devastating economy, and just how, as society, quite frankly, we have changed in the way that we exist and we go with our daily lives. What do we need to anticipate going forward? You've spoken about the lessons that can be learned. Is there something we need to anticipate? It can be even a different pandemic. How do we ready ourselves for the next big thing?
Since I was a baby medical student, that we've been anticipating the flu pandemic, and it turned out not to be flu, it turned out to be the coronavirus. And the terrible thing is that it's still on its way. Every prediction, every virologist will tell you it's coming. We're just not 100% sure. It might be this year, it might be next year, it might be in 20 years' time, but it is coming. So this is a terrible warm-up for what might be another pandemic that's coming. As humans live more and more close proximity with animals, all these viruses are the one that arose in the US, the one that arose in the Middle East, the one that came out of Asia in 2002 or so. They all come from the way that we treat animals and how we eat animals and prepare and slaughter animals. And I think there needs to be some reflection about that, but we also need to prepare the society for the fact that we're probably going to have to shut down our societies like we did here in the future. We just can't predict when that is.
Where do we need to start? Where does government need to start? Does it start with policy, maybe around the health care system? Where does it begin to prepare for the next big one?
So I think that investing in good surveillance systems internationally, supporting organizations like WHO to have sustained surveillance so that on the one hand we don't underreact, but we also don't overreact. So, when Ebola happened, WHO was criticized for underreacting. When when MRSA came along, it was accused of underreacting. We need to have some sort of early warning system that says there's a certain trigger point at which we will need to shut down as a society, shut down air travel. And for that, you need very calm, public-spirited people. Internally, we must not make the mistakes we made this time, which is firstly get involved in silly policy debates and things. We need to be thinking about how do we protect vulnerable people. In this case, children actually weren't vulnerable, but in all things like flu, children are incredibly vulnerable. So let's say we get a flu epidemic in 10 years' time. How are we going to do things differently in terms of protecting children?
All right, Francois Venter, thank you so much for your insights as we mark this grim milestone. 1 million people so far have died from COVID-19.